Well, the first item on the, let me rephrase that. The first item on the agenda today was a briefing on Ebola by the Health Authority for the City of Houston, Dr. David Parse, and the Health Department Director, Stephen Williams. I think it was a good overview of the situation, and I believe that council members and the public who had an opportunity to view their presentation will come away with a much better understanding of. Didn't touch it. Whose microphone was that? Oh.
I'll send a bill.
Are you sure? I'll wait. Right. Ebola is a very, very serious disease with deadly consequences. But Ebola is not a new disease. It has popped up in certain parts of Africa for nearly 50 years. It can be managed with modern medical practices. And in a world in which, in a matter of hours, anyone can get from one side of the globe to another, these sorts of diseases can pop up anywhere. We have to make sure that we don't inadvertently do something that would prevent someone who might have been exposed to Ebola from coming forward. We also have to make sure that we don't do anything to overreact to something that actually has not occurred in Houston yet. Our first responders, our hospitals are brushing up on their protocols, but a reminder to folks that Ebola is not transmitted by asymptomatic people. It means if you don't have any symptoms, it's not going to be transmitted. And B, a lot of other things that happen to us in the fall, particularly the flu, start off the same way that Ebola might. If you have not traveled in Africa, if you have not had exposure to someone who has, or not, and just not all of Africa, if you haven't traveled to the hotspots in Africa and you haven't had exposure to someone who is being treated for Ebola, there's no reason to expect that you have anything other than the flu. But as we do every year, we ask people to take normal precautions. We ask people to take flu shots, and we ask people who are sick, if you're not feeling well, stay home. Call your doctor if you are concerned, and allow them, your healthcare provider, to help walk you through if you have any particular risk factors that would prompt further intervention. Do you all have questions about the presentation?
So, Mayor, we have the largest medical center in the world, fourth largest city in the country, a very active port, obviously. What's the likelihood, in your opinion, that we might have a case here in Houston?
There is no doubt that we will have a case of Ebola eventually. The expectation is that we will have a case of Ebola. It might not be with this outbreak. It might be 5 years from now with the next outbreak of Ebola. But because we are a huge city with a large international population that comes in and out, it's going to happen eventually. But that doesn't mean it's going to happen tomorrow, and it doesn't mean it's going to necessarily happen with this outbreak. Ebola first came onto the Western radar in the 70s, and there is no vaccine, there is no cure, but there is treatment. And with a good isolation ward and modern medical practices, the chance of someone allowing their own immune system to kick in and help them survive the disease goes way up. And so we do have the advantage of having the Texas Medical Center here, but there shouldn't be an expectation that, for example, the fact that it was sort of random chance that the first case came into in the United States came into Dallas. Dallas is perfectly capable of handling that disease. Any other major city with high-level trauma center, for example, or fully functioning isolation wards should be able to successfully manage the disease. We wouldn't be considered a center of excellence where people would come here specifically for treatment. There are other hospitals that would do that. But our expectation is that we have to be ready if a Houstonian exhibits symptoms of the disease.
Mayor, the hospitals tell us they are prepared for a potential case. How do you, as mayor, know that they really are prepared?
Ebola is not the only disease for which we train. And our protocols for dealing with contagious, highly contagious diseases or infectious diseases changed after 9/11, and we really became aware of how vulnerable the United States could be to a terrorist attack. And so a lot of the things that we would do in response to Ebola are also something that we practice annually in our updates on our overall emergency preparedness response for terrorist attacks. And so the weakest link in any system is the individual on the ground who fails to remember their training, fails to follow the appropriate protocols, and somehow slips up. It's one of the ironies, as Dr. Peirce pointed out today, is for the unfortunate gentleman in Dallas. His name is Duncan, I believe. While there are 2 people who treated him in the hospital who are now being monitored for Ebola, the family he was staying with is in isolation and has shown no symptoms. And so I think it's that kind of mystery is what causes people to be concerned. If people want to know, if I do this, I won't get it. If I do that, I won't get it. Until we figure out exactly how the 2 nurses in Dallas might have been exposed, there's going to be some anxiety. But again, there has not been any case of Ebola in Houston to date, and we want to be aware and cautious. We don't want to overreact.
Mayor, just on the hospital preparedness, it seems like, Dr. Peirce and all the local, you got the Med Center, all these folks, frontline people, major hospitals are pretty prepared.
The state of Texas has set up a task force. The Houston region has set up a task force that will communicate to the state of Texas task force. Statewide task forces and groups are working with the CDC, so at all levels there is communication.
How much do you think the city of Houston working on getting some of the like the suburban hospitals, the smaller hospitals that may not have as much staff, or they're not used to some of the high-level disease preparedness that goes on a regular basis in the city core?
Any acute care hospital has people on staff who, and I don't know the term, they have people on staff who are tasked with this kind of infection control and making sure that diseases don't spread within the hospital. Every one of those acute care hospitals in the region has been communicated with, and the protocols that will work on normal disease control will generally work for Ebola.